So I'm Dr. Charles Modlin, and we're here for another episode of our Music and Medicine program. And we have a very important program this evening. We're actually going to discuss a serious health topic that I think that it's important that we all become aware of. It's called seasonal affective disorder. It's a form of severe depression that actually affects millions of Americans every year. It can happen at any time of year, but it's most typically prevalent at the fall season and the winter months. And it can actually escalate to serious, significant clinical depression. And there have been many cases of suicidal ideation and suicide as a result of this condition. Again, a lot of people are not aware of seasonal affective disorder. It's also, again, it's a form of depression. And it's something that we're going to be speaking with a clinical psychiatrist, Dr. Oge Ezimakor. She's a psychiatrist at the Metro Health Medical Center here in Cleveland, Ohio. But I'm joined by my co-host, Jerome Brown. Hey, how you doing, Jerome?
What's up, my guy? How you doing, man?
Yeah,
it's always
we're
a pleasure,
in there.
Doc.
Yeah, you too. Again, it's a difficult time of year. It gets dark around 4:30 now. There's not much sunlight, and that really affects our mood. Many people are affected by this seasonal affective disorder, seasonal depression. And again, we're going to be talking with our psychiatrist, who's going to give us a lot of important information about this condition. But I personally know many individuals who suffer from this. It's at this time of year. Again, we don't have much sunlight. Some of the symptoms we're gonna talk about: feeling fatigued, not interested in our normal activities, being irritable. But we're going to get into more of that later. I wanted to welcome in to the show also a phenomenal musician, singer, recording artist,
Yes.
Kay Davis. We've had Kay Davis on the program before, and we're thrilled to have you back, Kay. Thank you for thanks for taking some time out to be here, and we look forward to hearing some of your music. And I just wanted to basically, state that there are a number of potential therapies, and we're going to get into that with our psychiatrist. But one reason why we have you here, Kay, is because we know that music is therapeutic. Music is medicine for many people. It is for me. It uplifts my spirit. When I'm feeling down, especially these winter months. And so, again, we thank you for being here. Jerome, what are your thoughts about music?
Well, music, again, is therapeutic. It's soul food, and that's the thing about it, man. Without music, this would be a lonely, chaotic, and quiet world. It's a freedom of expression. It's a vibration. And it's a pleasant vibration, which we all need, regardless of the genre, So anytime we can have Kay or someone as talented as she is on, it's better for everybody involved, man, because it's just a beautiful thing.
It's vibration, it's energy. And so, yeah, you're so right. But how about we hear a little music, Kay? What do you think? What are you going to play for us?
Sure. I have in mind something really nice. I like Brian McKnight. I love his voice and his runs. And so I'll start with that. But before I start, I did have a music reference that I'm wearing today. Aaliyah. A lot of people love Aaliyah, me included. And I love her voice and music. And so I just, wanted to give a little Aaliyah love today. And also, the person who took this shot, the photographer, is Jonathan Mannion. And he's actually from Ohio. And I'm from Ohio.
Nice.
So. Thought it was a nice little thing to do today. So here we go. Let me get the keyboard setting right. We're listening to bells right now. I know it's that time of year, but I'm going to get the regular keyboard setting out. Okay, so it sounds more like a piano. And I'm happy to be back. This is pretty cool. Ooh, yeah. Yeah. pretty soothing, you know. I can always relax to Brian. Yeah, yeah. Yeah. Still have your picture in a frame. Hear your footsteps down the hall. Yes, I swear I hear your voice driving me insane. How I wish that you would call to say, do I ever cross your mind anytime? Do you ever wake up reaching out for me? Do I ever cross your mind anytime? I miss you, yeah, yeah, yeah. I miss you, yeah, 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 yeah. I miss you.
Whoa. Hey, look, sad turns into happy just that quick. You know, just that quick. And that's what music does, Doc. That's what you was talking about all this time, you know?
You know, I'll tell you one thing. Seems like she was looking at me, not you, Jerome. You know, or she's looking at somebody out there in the audience.
Hey, music will hit you in the heart, man. I tell you that, you know? So anytime we can have somebody like Kay on, I tell you, it's a beautiful thing, man. That girl has a wonderful voice.
I love you guys.
So, Kay, how can listeners find more about you, your music? Where are you going to be performing and appearing?
Well, they can go to kdavislive.com. That's my house. That's where I live. And it's just the letter K. So some people try to spell it out. It's just one letter, K, and then Davis, DAVISLIVE. That's live.com. kdavislive.com. If you go there, then you scroll all the way to the bottom and put your email address in. And I'll send updates as far as when I have a show, when I have new music, and just different fun things like maybe on YouTube. You could go, you know, maybe I'll do a live stream or something like that, or, you know, a new video. So you'll get all the information at kdavislive.com.
So how long have you been playing keyboards and singing?
Oh, you know, I've been playing the piano. I used to have a piano in my home when I was growing up. So I started playing it about 8 years old, but I play by ear. So, yeah.
Yeah, that's outstanding. So, Kay, have you ever heard of seasonal affective disorder or seasonal depression? Anybody that you know of maybe suffers from this condition?
Yeah, you know, I have heard of it. I would say that I've had it, you know, numerous times and then I try to do stuff that will combat it since I know that my mood goes down. 'Cause like, I'm a sun person. I love the sun. I'll travel anywhere to get to the sun. And you know, I've been to Phuket, you know, and actually I've been to China, and but it's hot where I love to go, in Hawaii and stuff like that. But here in Cleveland, it's not always that hot, and we get like this short summer. So when I'm here, I have to really watch my mood. Because I love to be energetic and do stuff, and if it's really bad outside or the sun's not shining, it does kind of put a damper on things.
I have a very special guest with me today, Dr. Oge Ezimakor. She's a practicing adult psychiatrist, and we have a very important topic, I think, that we must discuss. Oftentimes this topic, you know, when we're talking about mental health issues, a lot of times we don't talk about these issues as much as we can, because, you know, mental health issues affect millions of people in the United States and across the world. But one particular topic we want to talk about today is something called SAD, S-A-D. It stands for Seasonal Affective Disorder. And again, this is a syndrome that actually affects millions of Americans and causes a lot of anxiety, distress, depression, and other symptoms that interfere with individuals' ability to function daily and adversely affects individuals' lives. And so seasonal affective disorder is a disorder where oftentimes individuals in the fall and winter months experience increased incidence of depression to where they can't really function, and it's related to the changing season. Most often people experience this syndrome, this SAD syndrome, in the fall and the winter, but there are some individuals who actually a minor percentage of these individuals will experience some of these symptoms even in the spring and summer. But we're going to let Dr. Ezimakor actually go into more detail about what this is. I'm not a psychiatrist, but again, I understand the importance of including mental health in the discussion of the overall health and wellness of individuals and communities. So Dr. Ezimakor, thanks for joining us on the program, and how are you doing today?
I'm doing very well. Thank you, Dr. Modlin, for inviting me on this platform and to be a part of this discussion on this relevant topic during this time of the year. Thank you.
So, it's, we're going into, we're late fall. We're almost, going into the winter, and it's getting cloudy. And those of us who live in the north, we've already experienced some snowfall up here. There's a chill in the air, and there's, it's cloudy and it's getting dark around, 4:30 right now. It's going to be getting dark, even earlier pretty soon. And so there's less daylight. And so that a lot of people have the winter blues. A lot of times people say, they have the winter blues, and they'll just dismiss it. But we're finding out that this can be actually a very serious condition and situation for many people, and it's something that cannot be ignored. So can you give us more information about this seasonal affective disorder syndrome?
Definitely. And so, again, this is a very relevant topic of discussion to have at this time of the year. And I think the goal and objective of this discussion is to, educate people about seasonal affective disorder, SAD for short, and kind of help people recognize the symptoms and be equipped with the knowledge on how to sort of tackle those symptoms when they see them, or maybe prevent a worsening of the symptoms so that they can function optimally during this period. And I know that, people know SAD as seasonal depression, or like you said, winter depression. And some people, just call it winter blues. What you don't want to do is ignore and brush it off as just simply winter blues, because these symptoms might actually start out very mild and become more severe as the season progresses. And so this is something that you want to take seriously. It is a type of depression, like you already know, with seasonal pattern. And what does this mean? It means that the mood changes with seasonal changes. And so, like we said, the symptoms will start in the fall, usually, and will last typically into winter months, and usually would improve in spring. Less commonly, like Dr. Modlin had mentioned, we have people who could have seasonal affective disorder in spring or even early summer. That's not very common, but that can happen as well. And it's been found that about 5% of adults in the US are affected by seasonal affective disorder. And it typically starts between the ages of 18 and 30. So that is something to really look out for, and make sure that we're taking care of that. So I would like to go into details about what really, causes SAD. what's implicated in the cause of seasonal affective disorder? Because
But
everyone
I'll,
says,
no,
yeah,
but I'll just interject here real quick. Living up here in Cleveland and Northeast Ohio, again, the fall, the winter months, I just was thinking a lot of times we associate the winter and fall blues with the fact that the Cleveland Cavaliers and the Cleveland Browns are not doing well. I mean, that's so, but it's beyond that. It's not just, that. So
it is beyond that, and definitely things that we will talk a little bit about, the part that you brought up in management, because there are factors as well that can worsen the presentation of SAD. So the way that we're processing things that are happening around us, are we having a lot of negative thoughts about things, that definitely will worsen SAD and depression in general. So very true, but it should not be dismissed as, oh, I was just not happy with the Browns, or it's really beyond that.
yeah, our quarterback is hurt again or whatever, so it is beyond that. But before you get into the causes, I think we want to maybe mention to the audience what some of the most common symptoms are. I mean, we talked about feeling depressed, sad. I've heard a lot of times people just want to sleep all day. They're very fatigued, tired, don't want to do things that they normally would want to do. I mean, those are probably some of the most common symptoms.
Yeah, those are the most common symptoms, actually. Oversleeping, feeling fatigued even when you've slept a lot. You still feel really tired. Changes in appetite, that's usually with overeating and craving for high carb foods. People notice that they're beginning to want to eat carbohydrates a lot and overeat more than usual. And then, of course, there is consequently weight gain that comes with that. So people start to get weight. And also that feeds the mood, the negative mood, because then, they start to feel not very good about how they're looking and with the weight gain. And so it becomes like a cycle of events. It can also include other symptoms of depression, like you mentioned, feeling sad, depressed, having a loss of interest or pleasure in activities that were once enjoyed, feeling worthless, or guilty for no reason, just that chronic feeling of just worthlessness and feeling guilty. And some people have difficulty with concentrating even on very minor tasks. They're not able to concentrate. They can make decisions, and it might get to the point of thinking suicide, thoughts about death. And that's the most severe form.
We've talked about on this program many times how, and a lot of people don't know that there is a connection, but there's a real connection between our mental health and our physical health, our physical well-being. If you're chronically stressed for whatever reason, that actually can increase your serum cortisol. There's certain hormones in your body that actually can elevate your blood pressure, which can have a negative effect on your heart, your kidneys, your brain, your peripheral vascular system. So, can potentiate or worsen diabetes. So physical disease can actually be caused by mental anguish, mental distress, and even the seasonal depression, seasonal affective disorder. So no, it's a very important topic. And then, what we want to do with this program, we want people to pass this information along so that others will know about, this condition of which we speak. So you were going to talk about what are some of the causes for this seasonal depression, if you could maybe go into that also.
Yes, absolutely. So the specific cause of SAD remains unknown, actually. But what has been implicated in development of SAD is reduced exposure to sunlight. And we do know that there are chemicals that are released in the brain that are responsible for maintaining our mood and the biological clock, which we call the circadian rhythm of sleep. And that simply means that the body is able to stay awake during the day and go to sleep at night. And so when you have sunlight helping in maintaining chemical balance in the brain, a reduction in exposure to sunlight that we get during the winter seasons would predispose us to having this chemical imbalance in the brain. And so that would negatively then impact the mood and sleep.
So yeah, I mean, again, this is not my specialty, but again, I want to communicate and disseminate information, as much as we can out into the community, and so, I know that you mentioned some of the chemicals, in our brains that actually help control our moods, our emotions.
Yes.
Serotonin, melatonin, or just some of the names.
All the
that can be.
names, melatonin, serotonin, so sunlight exposure would increase serotonin levels. Melatonin levels actually decrease with sunlight, and which is why melatonin levels increase at night. And because of darkness, melatonin is a chemical that helps us to be able to initiate sleep at night. And so the levels have to increase at bedtime for us to be able to fall asleep. And that's usually triggered by darkness. And so what happens is that we do have an increase in melatonin levels, most times during winter because we don't have enough sunlight. And so people are feeling sleepy most times. And that's something that could cause a lot of imbalance in the chemicals in the brain. And so you have serotonin levels that might not be as high as they should be. You have melatonin levels that are increasing higher than they should be. And so there's this chemical imbalance that negatively impacts the sleep pattern that we should have and also our mood.
So what you're saying, it interferes with our normal circadian rhythm. And so I guess one solution would be for us to move down to the equator or closer to the equator down in Florida and, Miami and Cozumel and Cancun. I guess that's where we need to go.
Exactly. I think we plan to all do that. Yeah. And actually, this is location is one of the risk factors that actually increase the likelihood of having SAD. So people who live far north or far south of the equator tend to have an increased risk of having SAD, as opposed to people who live closer to the equator. And so, unfortunately, we have a very high risk for developing SAD in this region.
Yeah. So, because, we don't really exactly, like you said, we don't exactly know what causes it, but it's related to the amounts of sunlight that affects the chemicals in our brain. Is there a predictor, like if somebody, and I believe I read that if you have a family history of this condition, then you yourself are more likely to acquire the condition. So it's important to talk to your family members, be open and talk about what you're experiencing. And
absolutely. Genetics have been implicated in development of SAD. So if you have family members, especially first-degree relatives, who have a diagnosis of seasonal affective disorder or even other forms of depression, then that places one at a higher risk of having the SAD. People who have already been diagnosed with depression or bipolar depression also tend to have higher risk of developing SAD. And sometimes they just manifest as a worsening of their already existing depression during winter months. And so that's something that we need to recognize as well.
And I think you said it can progress from one year to the next year. It can actually worsen, get worse as you get older. And younger people are more predisposed than maybe older adults also.
Exactly.
Yeah. So the treatment, yes, please, go ahead.
It does cut across all ages. Typically, like I said, it starts between the ages of 18 and 30, and then it can affect young people, it can affect older people, and especially, like I said, people who already have diagnosed mental illnesses are prone to that as well.
So, you know, when people are depressed, a lot of times they resort to drinking alcohol or certain vices to actually help self-medicate. You know, taking other medications or drugs or abusing prescription medications, things like that. So there is hope out there. There's help out there. You know, one thing I've heard is that maybe we could encourage people to use supplemental vitamin D or oral vitamin D supplementation that might help. Sun lamps, I've also heard may be of some benefit. I don't know of how much benefit.
Mm-hmm.
I've never actually tried, and I've had this seasonal affective, you know, disorder to some extent. You know, the winter blues.
Mm-hmm.
Exercise is something that is recommended also, I understand.
Definitely. So there are different modalities of treatment that are employed. We usually encourage people, now that we know the symptoms, to look out for. If you notice all these symptoms, when should you actually see your doctor? Because you really need to get an evaluation to determine what's the best treatment modality for you. It is absolutely necessary to do that. It's normal to have transient fluctuations in mood. That can happen, you know, for a couple of days or so. We feel down, we don't want to do anything. But if you're beginning to notice that it's ongoing for days on end and not stopping, and you're beginning to have some or most of the symptoms that we've already mentioned, then it might be time to seek evaluation from a licensed, trained medical provider. Especially if you're having problems with your sleep patterns and appetite, that is a pointer that you really need to be evaluated. And
You know,
like
yes.
you said, when people start to turn to use of substances and, you know, things like alcohol to help them, you know, to provide comfort for them or relaxation, things like that, then that's another pointer that, you know, this is something that probably has setting and needs evaluation. So I would really encourage people to be able to know what's going on and when to seek the evaluation that they need. Again, if someone feels hopeless, is thinking about suicide, you know, this is a very crucial time to really talk to someone. And we have the National Suicide Prevention Hotline that people can call to seek help. We know that when people feel suicide, they don't want to talk. That's the time that they really don't feel like talking to anyone. But we really encourage anyone who feels suicidal to please try to pick up the phone, call the National Suicide Prevention Hotline. It's 1-800 273 8255, and someone should be able to help you. Or one can just walk to the or go to the nearest emergency room for evaluation. This isn't something that you could potentially deal with yourself and by yourself.
And the other message is if you have a family member, a friend, a colleague who you think may be contemplating suicide, harming themselves, speak up. I mean, approach them. And,
Exactly.
you know, we have to be aware and knowledgeable what some of these signs, suicide risk signs are, and then take action. Because like you said, they themselves may not be willing or in the mood to call themselves.
That is very vital. Being able to, you know, look out for each other. What are the signs to look for if you have a family member who's isolating in the room? not going out as much as they used to go out, and you're noticing that their mood has really dropped. They look depressed. They maybe they get irritable. It might not just be depression, just looking depressed. It might be that they just get easily irritable, unlike what they're used to being. That's a sign that there's something going on. Take a moment and sit down with that family member and have a one-on-one with them. Ask them questions. What's going on with you? How can I help you? Is there something bothering you? Give them a chance to be able to open up to you. And I think that we all should pay attention to our brothers, our friends. Be our brothers' keepers, basically.
All right, I appreciate that. Now, you mentioned that in many situations, individuals should seek therapy, should seek counsel with a licensed psychotherapist or psychologist, psychiatrist. For example, and again, I guess it would really vary according patient to patient. But is that like a long-term therapy, or something where somebody would have to be in counseling like for months or years for something like this?
With psychotherapy, it's really there's no clear-cut duration. Usually, most psychotherapies would last for at least 3 months to 6 months, and so it kind of depends on what's exactly going on with the person and what the therapist feels. If the therapist feels that having more time, longer periods, depending on the progress during the sessions, will be helpful, I think that they usually would extend the therapy. If this is someone who's chronically depressed, has a tendency to lapse into depression, they typically might just want to continue the therapy. It might not be as frequent, even if it's like once in 2 weeks, even once a month, really does help. But during the periods when they're feeling depressed and having a seasonal affective disorder or depression, that's the time that they really want to be in intensive psychotherapy with a licensed therapist. Maybe once a week would be more helpful than spacing it out. So and that's something that is an adjunct as well. Using different modalities have been shown to be more helpful than going through just one. So we do have the light therapy that you had mentioned. So the light therapy is a very effective way of treating seasonal affective disorder, and it's been effective in so many people. And this is where there's a light box that's placed next to the patient's bed, and the patient sits a few feet away from this light box. The goal is to have this individual exposed to the bright light from this box within the first hour of waking up from sleep. And so it could be done every day, depending on what is agreed with the mental health professional. Some people want to do it 3 times a week, but it's really, really important to speak with your mental health professional, because we do know that people with bipolar depression, when we recommend light therapy, we have to really follow them, because some of them might become hypomanic or even manic just using the light therapy. But again, it is a therapy that has been shown to be really effective. Another modality of treatment is medication. So antidepressants, different antidepressants have been shown to be effective. Again, your mental health professional would decide which ones would benefit the person if they're depressed and having a lot of depression, especially the severe form of this seasonal affective disorder. You want to make sure that you're giving them some form of antidepressant to help them. And so that is something that works in combination with the light therapy as well, and with the psychotherapy as an adjunct. And the psychotherapy, like we mentioned, is to help with any negative thoughts that we might be having that could be worsening what is already going on, and kind of feeding that depression. that's where the psychotherapy comes in. And there's actually a specific technique that has been shown to be helpful. It's called CBT. That's cognitive behavioral therapy. So as the name goes, cognitive, is about the thought process behavior therapy. So it targets the way that we're processing thoughts and the way that's affecting our behavior and then consequently our mood. So it starts with the thoughts. How are you processing things? How are you thinking about things? Are there more positive ways to think about these things that would better influence your mood and behavior? So all these modalities are usually more effective when they are combined. And that's why it's really, really important that the patient speaks with a licensed, trained medical professional to determine what treatment plan would be best for them.
Yeah, that's some incredible information and valuable and in many situations life-saving information that you just presented, and I appreciate that. I would think, and again, I don't know, but I'm asking you, like many medical conditions, if you can try to intervene even yourself with certain modalities early on before it gets to an advanced stage, I would imagine that would be of benefit. I've heard things like, sleep hygiene, trying to go to bed and wake up at the same time, trying to, maintain your schedule even in the fall and winter helps. Exercising, as much as you can, staying hydrated with water. You said positive thoughts, being around people, trying to communicate with people, and don't self-isolate. So these things can maybe, if we could start to implement these things even ourselves in early stages, maybe it won't advance to the point where it would become a critical
Exactly
situation for us.
Yes, absolutely. I completely agree with you. Prevention is definitely always better than cure. So what I would encourage is try to, now that we know that SAD is related to exposure to sunlight, um, being able to increase our exposure to sunlight even before the winter months set in would be very important. So, continuing that into the winter months, from the summer to the fall, making sure that we're giving ourselves the opportunity to spend some time outdoors. It could just be taking a short walk or even a long walk if you're able to do that. Do things that keep you outside. It might be something as little as just bringing your lunch to a nearby park and just sitting down and just eating your lunch there just to get some sunlight. Even when it's cloudy and cold, it's better than being out there than being inside. So little things like rearranging your home or your office space so that you're kind of facing the sun or exposed to sunlight during the daytime, that is also very important. So with that exposure to sunlight, it's important as well to discuss with your doctor, because we do know that exposure to ultraviolet light could increase the risk for skin cancers.
Sure.
So you want to make sure that you're discussing all of these options with your mental health provider and your primary care provider as well. And taking care of your general health is really important. General wellness, and this can include just exercising. If it's something that you start before the fall and winter months, to be able to continue this lifestyle into these periods, because these are periods where, because of the way that the weather is so unconducive outside, you don't want to be outside. And so being able to push and know that this is a time that you even need to be going out to exercise, to be doing all of these outdoor things. This is a time that it's really more important to do these things. So regular exercise is really important. When we exercise, what happens is that we release some chemicals in the brain that actually improve our mood. So things like endorphins, would help with uplifting the mood when you exercise. Ensuring good sleep, like Dr. Modlin said, try to have a regular sleep pattern. Going to bed the same time, waking up at the same time every day. It might not be easy, but it's something we can work and strive towards achieving, because we do have a lot on our schedule. So if there are things that are keeping us late at night and making us have different schedules of going to sleep at night, that we need to look into those and know which ones we cut out, and just leave for the next day and be able to go to bed at a reasonable time that's consistent with daily schedule. I think that that's something that we can incorporate as well.
So I appreciate you spending time with us, Dr. Ezimakor. So one last question. Can you tell the audience how they might be able to get in touch with you?
Again, I'm Dr. Oge Ezimakor, and I practice in Cleveland, Ohio. I work with a hospital here called Metro Health Hospital. So if you are looking to get in touch with a mental health provider, I encourage you to call and try to make an appointment with the hospital, and we can always get you in for you to be seen. Okay?
Yeah, thank you. So hopefully you'll come back and join us in the future for additional discussions. I mean, this has been outstanding. We've been talking about, seasonal depression, seasonal affective disorder. It's called by different names, but we know now that it can be a very serious and deadly condition, and so it's something that people can't ignore. We talked about some of the signs and symptoms and ways in which we can actually mitigate against that. So thanks for spending time with us, and we'll be seeing you again.
Thank you, Dr. Modlin. My pleasure. Thank you so much.
Okay. Thank you. All right.
Thank you. Bye-bye.
Bye.
One thing I've heard, and Dr. Ezimakor was speaking with me earlier about, again, we talked about the different treatment options for this condition. She was telling us about light therapy. I'm not going to open up this light all the way to, but this is, the recommendation is that actually the benefit is through your eyes. It's not through your skin, but it's recommended that you use light therapy every morning for about 20 minutes, and it will elevate your mood. It stimulates the chemicals, within your body, your brain. But I'm going to give it a try. It's this. Actually, again, I'm not here to endorse one particular product. This is called Circadian Optics, but again, there are many different variants out there on the market. This one was very inexpensive, but again, I'm gonna try it out because I suffer from this condition as well. I like to be out on the beach in the summer, swimming and walking in the park, and we can still do, we can get out and walk and enjoy the winter. I don't enjoy it as much as I used to, when I was a kid, but I know Jerome, you're out there in the middle of the winter, snow, blizzards, fishing, from what I understand.
Well, I do a little bit of everything, and that combats that sad feeling, and then, like you just did, the light. When you get that light is energy. Darkness is attributed to depression and down. And when we get daylight savings in Cleveland, especially, your day ends about 4:30. Typically 5 o'clock, in comparison to 9:30. So you don't start feeling down during the summer months until around 8:39 till your body winds down. This natural thing that they do, when at 4:30 you start to wind down, at 6:30 you're tired. You're either tired or you're trying to push yourself the other 2 hours, and that's part of that sad seasonal affective disorder right there too. So you have to be very mindful of what the change that's happening within your body. And like Kay said, what you do is you think of other things to motivate you and energize you through. So that light therapy is something that I may want to try someday too. You know, that's pretty cool.
Absolutely. You know, I mean, with the fewer hours of sunlight, it affects our internal biological clock, our circadian rhythm. So again, it's something that we need to be aware of. This condition, we need to combat it. You know, we need to recognize the symptoms, not only in ourselves, but in our family members, our friends. And, you know, if we see that they're struggling, then, you know, speak to them, give them recommendations in terms of what they might do. And again, there's nothing wrong with actually seeking help, a counselor, a psychotherapist. Again, it used to be taboo to admit that you need any kind of mental health, you know, therapy or assistance. But we know now that, you know, the importance of maintaining our mental health, because if we don't maintain our mental health, it can cascade into a bunch of, you know, physical manifestations of disease. So, Kay, can we hear a little bit more?
Yes, I've got something else lined up for us.
Yeah.
So while we're talking about camaraderie and how we should look out for each other,
Yes.
I have a song that is kind of shouting out somebody special. So we'll go for that one. Okay, I'm gonna start here. Let me put on my other earbud really quickly. Sorry about that.
Yeah, we enjoy seeing how you work. You know, your magic here.
Yeah, the artistry, you know.
Mhm.
There's a method to the madness.
Yes, there is. All right, here we go. Ooh, yeah. It's a sunrise on those brown eyes, yeah. You're the one that I desire. When we wake up and we make love, to me it feels so nice. Oh, you're the water when I'm stuck in a desert. You're the Tylenol I take when my head hurts. You're the sunshine on my life. Oh, I just wanna see how beautiful you are. You know that I see it. I know you're a star. Where you go, I follow. No matter how far. If life is a movie, oh, you're the best part. Oh, you're the best part. If you love me, won't you say something? You love me, don't you? If you love me, won't you say something? You love me, don't you? Please love me, won't you? If you love me, won't you say something? You love me, don't you? If you love me, won't you say something at all? I just wanna see. I just wanna see how beautiful you are. You know that I see it. I know you're a star.
Whoa.
You're a star. You're a star.
Whoa. Whoa. Very nice. Very nice.
Yeah, I know our audience is enjoying this. You know, so yeah. Again, thank you for being here. So you're gonna be part of our family here. We're future episodes of Music and Medicine. But
Yay!
yeah, we definitely want to hear some more. Jerome, what do you think?
I second that right there, buddy. Because the voice is pure. Again, we talked about energy earlier. The energy, the star factor. She's a star. Stars are bright. We're talking about sad. That goes right out the window after you hear her start singing. So it's dark outside currently. Because of the time change. So all of this goes hand in hand, man. This is brightening up everybody's day that's tuned in today. So, hey, I appreciate it.
And she's a talent from Cleveland also. And one day, I'm sure you're going to be in the Rock and Roll Hall of Fame. Don't you think? That's what you're aiming for.
Speaking it into existence. I appreciate
you heard it here first, y'all.
You gotta reach for the stars.
Awesome.
Yeah,
that's right.
So yeah, I mean, again, we've talked about a very important topic here tonight, and we want to entertain you. It's about combining health literacy education with music and entertainment. So you able to give us one more song, Kay? What do you think? What do you have for us?
Sure. Let's see what we got here.
Drum roll.
A good one. I'm gonna go with this. Let's go with this one. Jay, you got something to say, Jay?
Man, I always got something to say. I'll be rapping and singing and cracking jokes and everything, I just want to let everybody know, though, this is not something sad. It's not something that everybody thinks of typically. Yeah. They just feel, man, I feel down. I feel this, but they don't attribute it to what's actually happening with the seasons. They just think they're just feeling down. So once you really understand that this is an issue that affects everybody, I would say on the planet for that matter, because we all here together, then you can better understand how to handle and treat this condition with healthy exercises for your mind. And again, Kay has brought that to us today. So just keep in mind, this is not something that you would normally think about, but it is affecting everyone. So let's be conscious of that.
Yeah, you don't have to suffer in silence. And just one more note, the data shows that this is occurs more in younger people and also slightly more in women compared to men. So again, this is not something that you have to suffer in silence about. There is treatment available. And so, recognize your symptoms and seek treatment if you need it. So, hey, Kay, you want to close us out?
Sure. I'm ready. Let's go. We stand side by side till the storms of life pass us by. Light my life, warm my heart. Say tonight will be just a start. Yeah, y'all ready? I love you here by me, baby. You let my love fly freely. I want you in my life for all time. Listen, I want to know what good love feels like. Good love. I want a love that's going to stand the test of time. I want to know what good love feels like. Good love. Morning, noon, and night. Forever on my mind. 'Cause I'm caught up in the rapture of you. Oh. Yeah. Y'all ready? Let's go. Whoa, whoa. We're gonna go back around on the hook. Y'all gonna sing with me this time. Let's go. Yeah. Listen. I love you here by me, baby. You let my love fly freely. I want you in my life for all time. I caught up in the rapture of you. Oh, nothing else can compare. When I feel the magic for you, oh, this feeling's always new. I caught up in the rapture of you. Oh, yeah. Yeah. Ooh, yeah. Oh, ooh, yeah. All right.
Whoa. Whoa. Fire. There's not a lot of people that can do that song, you know?
Anita
Beautifully
Baker.
done.
I love Anita. She's awesome.
Yes.
Yeah.
So it's not
Yes.
only your music, but it's your smile that just makes me smile, back. I mean, so yeah, I appreciate that, so.
Likewise, I have fun with you guys.
Yeah. That was great.
Well, thank you.
So, but we're going to be having you back on the show for more, and I hope the audience enjoyed the music. I know we did, and I know they did as well.
I look forward to it. Thank you.
So we're gonna get some of your recordings, and I'm going to be listening to this in the operating room while I operate. I don't know if people know that we listen to music when we operate.
Yes,
Right.
you do. I've had an operation before, and you guys are awesome, really.
So music is medicine.
Yes.
It is.
And again, how do they find you, Kay?
kdavislive.com. I'm on Instagram, Facebook, and YouTube, K Davis Live. Yeah.
Okay.
So thanks, Kay. Thanks, Jerome. Then we'll see everybody next time.
Absolutely.
Love you guys. Bye.
Great
Bye.
job, everyone.
Thanks.